Hi everyone, this lesson is on somatic symptom disorder. So we're going to talk about what this condition is. We're also going to talk about the DSM-5 criteria for diagnosing this condition, and we're also going to talk about some of the possible treatments for this condition. So somatic symptom disorder, or SSD, was previously known as somatoform disorder, and it was changed to somatic symptom disorder in DSM-5. It is a psychological condition involving somatic symptoms that are distressing and cause significant dysfunction in daily life. So it is a psychological condition involving somatic symptoms. Somatic symptoms are bodily symptoms. So there may be pain in an arm or pain in the leg that doesn't seem to be caused by an underlying organic condition. It appears to be related to a psychological condition. Oftentimes, patients will believe that the symptom or symptoms are indicative of a serious underlying disease or disorder. And it may be related to increased sensitivity to bodily sensations. So this condition may simply be due to the fact that a patient may be more sensitive to certain somatic stimuli. Now, the epidemiology of somatic symptom disorder reveals that it may affect upwards of 7% of all adults, and it is associated with the following conditions, including depression, anxiety, and the use of certain medications. Now let's talk about the signs and symptoms and how this condition is diagnosed via the DSM-5 criteria. So criterion A of the DSM-5 criteria states that a patient must have one or more somatic symptoms or bodily symptoms that are distressing or result in significant disruption of daily life. So they have to have at least one bodily symptom that is distressing, causes them significant distress that leads to significant disruption of daily life. So they may find that they can't think of anything else except the symptom. It may cause them to miss work or impact their relationships. Those types of disruptions in life would be required to say that criterion A is met. Now, that's not the only criterion we need. We must have at least criterion A to even progress to criterion B. So criterion B states that the patient has excessive thoughts, feelings, or behaviors related to the somatic symptoms or associated health. They also have concerns as manifested by at least one of the following: disproportionate and persistent thoughts about the seriousness of one's symptoms, persistently high level of anxiety about health or symptoms, and excessive time and energy devoted to these symptoms or health concerns. So again, as you can see, they have a very significant somatic symptom, at least one of them, that impacts their life. They have excessive thoughts or feelings about that symptom and their health. And they may also have persistent thoughts of the seriousness of that symptom or persistently high level of anxiety about their health or that symptom, or they devote excessive time and energy to that particular symptom and their overall health. So that would meet criterion B. And then criterion C states that although one somatic symptom may not be continuously present, the state of being symptomatic is persistent for at least 6 months. So this is the time requirement for diagnosis of this condition. So this states that they must have a somatic symptom that meets criterion A and B for at least 6 months. It doesn't have to be the same somatic symptom. They may have their left arm is painful for 3 months and that goes away, and then the right foot is painful for another 3 months. That would make up the 6 months that we require. And then that would be enough to say that they have somatic symptom disorder if criterion A and B are also met with regards to those symptoms. So again, it doesn't necessarily have to be the same symptom. It could be one or two or many symptoms over the course of at least 6 months. Now, if they meet those criteria, that would be enough to say they have the diagnosis of somatic symptom disorder, but there are certain specifiers that can also go along with this condition as well. One of them is predominant pain. So if the somatic symptom is predominantly pain, they would have somatic symptom disorder with predominant pain. That would be the specifier. Another specifier would be persistent. Persistent would indicate that there are severe symptoms causing significant impairment and last longer than 6 months. And then there are certain levels of severity as well that can also be specified. So mild somatic symptom disorder would be where only one criterion B symptom is met. Moderate would be where there are 2 or more of criterion B symptoms that are met. And then severe is where there are 2 or more criterion B symptoms that are met, but there's multiple somatic symptoms. So that is the differences between the severity of somatic symptom disorder. So as mentioned before, we only need one of those features in criterion B for criterion B to be met. But if you have 2 or more or multiple somatic symptoms, that would increase the severity of the condition. Now let's talk about how clinicians treat this condition. Before we get into treatment though, I want to emphatically state that it's important to assess for and rule out other mental and organic diseases, because the symptoms that a patient may be reporting may actually be the symptoms of a severe underlying condition. So it's important to assess and perform appropriate testing for those conditions. Some psychiatric conditions that can cause similar symptoms include anxiety and depression. So it's important to assess for and rule out anxiety and depression. And some important organic diseases that could be causing the symptoms that a patient may be reporting includes multiple sclerosis. So it's important to actually assess for a underlying physical condition before stating that a patient has this condition. Now, some important aspects of treatment for patients with somatic symptom disorder include patient education. Many patients will continue to believe there is a serious underlying condition despite normal testing. So it's important to have appropriate, compassionate patient education for these patients. It's important to also promote coping mechanisms as well. Cognitive behavioral therapy is also important and can help with symptoms of this condition. So if you want to learn more about cognitive behavioral therapy, please check out my lesson on that topic. Mindfulness-based therapy is also another method of treatment for this condition. And some pharmacotherapies may also be employed if these previous treatment methodologies are not effective. And it's important to seek medical treatment and evaluation before utilizing any of these pharmacotherapies. And these include amitriptyline, fluoxetine, and St. John's wort. So with regards to St. John's wort, it'd be important not to use this with other SSRIs like fluoxetine or selective serotonin reuptake inhibitors. So if you want to learn more about other psychiatric conditions, please check out my psychiatric playlist. And if you haven't already, please like and subscribe for more lessons like this one. And as always, thanks so much for watching, and I hope to see you next time.